Dear students, today's our topic is acute diverticulitis. Diverticulum is outpouching of GI mucosa, finger-like projection. Diverticulosis is presence of diverticuli. Diverticular disease when diverticulosis becomes symptomatic. Site 95% sigmoid colon. Etiologies include congenital, acquired, include more than 50 years with increased intracolonic pressure. Reasons: constipation, chronic cough, heavy weight lifting. Pathogenesis: herniation of GIT mucosa through lines of penetration of blood vessels. Diverticular disease and acute diverticulitis can be compared. Diverticular disease include altered bowel habits, diarrhea alternating with constipation, or pain in left iliac fossa, intermittent colicky relieved after defecation, fresh perrectal bleed, one of DD of lower GI bleed, no weight loss, no lymphadenopathy, no metastasis. General physical examination reveal paler look. Abdominal exam normal. Perrectal exam reveal mass. Acute diverticulitis, pain in left iliac fossa, severe, constant, sharp, agonizing pain, GI abscess, nausea, vomiting, anorexia, constipation. On examination, 4 T's: tachycardia, raised temperature, tenderness in left iliac fossa, positive, raised TLC count. Investigation: TLC normal, diverticular disease, and diverticulitis TLC raised. Sigmoidoscopy or colonoscopy reveal mass in diverticular disease, and in diverticulitis avoid colonoscopy or sigmoidoscopy. Barium studies reveal filling defect, and in case of diverticulitis, investigation of choice CT abdomen pelvis, and in case of diverticular disease, investigation of choice CT scan abdomen. Treatment: in case of diverticular disease, control risk factors: high fiber diet, laxatives, antispasmodics, tablet mebibrine 135 mg 8 hourly. Surgery rarely required. In case of acute diverticulitis, mainstay conservative, NPO, mil per oral, NG tube, intubation, IV fluids, IV antibiotics, IV pethidine, diclofenac. Indication for surgery: only 20% of cases required. Complications: number 1, perforation, peritonitis, abscess, fistulas, life-threatening hemorrhage, post-infective strictures. That's it about diverticulitis.